Hello, my name is Uppal and I specialise in nose surgery. I'm going to talk to you today about the recovery after rhinoplasty. The most common questions we get asked are, when is the swelling going to go down and when can I get back to normal life? The answer is it takes a long time. The early recovery is 1 week. We wear a tape for 1 week and we need to keep it dry. After 1 week, it can get wet and the tape and little splint will come off. Initially, there's some swelling and bruising, but after 2 to 3 weeks, things start to get back to normal, so we need to be patient. Please keep in touch with us or the office if you need any advice and support along the way. Email us some photographs so we can keep updated. Or of course, you can pop in and see us at any time. Over 3 to 12 months, the swelling changes and improves. Most of the recovery happens after 3 months, but even 12 months to 24 months later, there are subtle changes in scar tissue around the nose. We can help that by massaging the top and the side. So first, we can use tape. The tape is used after 2 weeks after the operation, and we'll give you this. Essentially, you wear it at night only for 4 to 6 weeks. Some patients use it for 3 months as it still has some effect. We tear off a small piece, and the first tape is a U shape, goes under the nose quite firmly, and it's quite high up like that, like that. You can do it in the mirror, and the idea is to apply some pressure. The second tape is about 10 centimeters as well, and it goes not at the tip but just above, and the idea is to put it on there and push quite hard, and that gives the compression onto the cheeks, and that will squash it. You can reinforce this with further tapes across the top if you want to. You sleep like that, and in the morning get in the shower and the whole tape will come off. So in the morning it looks good, but over the day the swelling can get worse. The nose has a rhythm. In the morning it's swollen and then it goes down during the day. Exercise and hot temperatures or any allergies such as hay fever can make the nose swell up more. Some people have a runny nose, and that can be triggered by all sorts of allergies, which are complex and we don't necessarily understand them. So the breathing can be affected for at least 2 to 6 weeks. The sense of smell should come back over a few weeks. Most patients can find early on for the first few weeks they can't quite smile fully, but that will get better over a couple of weeks. The inside may be full of crust. It doesn't need physical cleaning, just showering and washing is sufficient. The inside will clear itself out when it's ready. You can use some Bactroban cream or Vaseline inside the nose. After 2 or 3 weeks, you can start some massage of any swelling. You can squeeze the nose and hold it for 5 seconds once a day. Further up, you can push on the swelling for 5 seconds once a day, and that will help compress some of the swelling. But please keep in touch with us and let us know if we can help at all, and we look forward to helping you. Thank you.